And we mentioned the news conference being held by health officers from 7 counties in the Bay Area. It has obviously begun. Let's join it in progress.
Mandating indoor masking for everyone, regardless of vaccination status. These health orders will take effect at midnight tonight. Across the Bay Area region, we are seeing COVID-19 cases surging, and hospitalizations are on a steep rise again, particularly among the unvaccinated. In Contra Costa County, we are alarmed at the rate at which COVID patients are filling our community hospital beds. The number of patients in local hospitals due to COVID have doubled in just the past 10 days and increased by more than 400% in the month of July. 4 out of 5 of these hospitalized COVID patients are not vaccinated, even though only 1 out of 5 Contra Costa adults is not vaccinated. We know that indoor gatherings present the highest risk for spread of COVID. While there may be slight differences between each jurisdiction's orders issued today, they all have one thing in common: a simple step, wearing a mask indoors, to provide one more layer of protection for everyone. I'd like to now turn it over to Dr. Sundari Mace, Health Officer for Sonoma County.
Great. Thank you so much, Dr. Farnatano. As was mentioned, we're taking this action today in calling for mandatory indoor masking for all residents in public settings because we're all seeing a sharp increase in COVID cases and hospitalizations in our jurisdictions, particularly among unvaccinated individuals. One thing that we want to emphasize today is that fully vaccinated residents are still far less likely to become infected and are well protected against severe illness, as well as hospitalizations and death due to the virus. In Sonoma County, our case rate for unvaccinated individuals is nearly 6 times higher than it is for our vaccinated population, even though our vaccinated population is far greater. Meanwhile, 86% of the COVID patients in our hospitals are unvaccinated individuals, and 100% of COVID patients in our intensive care units are people who had the opportunity to be vaccinated but chose not to. This is really tragic, given the widespread availability of the vaccines throughout the Bay Area. So if you've not yet received the vaccine, now is the time to do it. It's needed now more than ever. Vaccination will protect you, your family, and your community. That said, it's important that this mask mandate be for vaccinated as well as unvaccinated individuals, because we're facing a much more aggressive and contagious opponent right now, known as a Delta variant. It is now widespread in our communities, making up close to 95% of the cases. This is not the same virus that we were combating last year or even a few months ago. The Delta variant is 60% more transmissible than previous versions of the COVID virus. And we're seeing an increase in the number of vaccinated people who are now testing positive. Again, vaccinated people are still protected against the most severe outcomes of the virus. And in many cases, our hospitals are not even admitting vaccinated individuals, especially if they're asymptomatic or show mild symptoms. Nonetheless, there is evidence that vaccinated people can spread the virus to others. That is why everyone must wear face coverings when in public indoor settings. I would now like to introduce Dr. Navina Baba, Deputy Director of Health at San Francisco Department of Public Health.
Thank you, Dr. Mace. So we know that with the Delta variant and in general, COVID, there's an increased risk of being exposed to the virus in indoor spaces and settings. We know that indoor spaces are where most transmission occurs, and that's why we're basing a masking requirement on an indoor space. Face coverings protect you and those around you, providing an additional layer of protection for vaccinated people too. As mentioned, vaccinated people are much less likely to get COVID, and if they get it, they're likely to have mild disease. But there continues to be a proportion of people that remain unvaccinated, and there are some that are unable to get the vaccine because that vaccine is yet to be approved for them. If you're able to choose between an indoor and an outdoor space, we recommend that you choose outdoor activities. There are people who have to work indoors though. And for that group, we want to make sure that we are protecting them. Our frontline workers have been essential during the pandemic, and they continue to be essential during this reopening period. So both for the fact that there are people out there that cannot get vaccinated because they aren't eligible, and we want to protect our workers, we are urging people to mask indoors. And that's why this requirement is happening now. I'd like to introduce Dr. Lisa Hernandez, Health Officer for the City of Berkeley.
Good afternoon, and thank you, Dr. Baba. Masks are a simple and effective tool everyone can use, but we must remember that vaccine remains our strongest protection against the Delta variant and COVID-19 disease. Vaccines strongly protect the vaccinated from severe disease, from hospitalization, and death. They also reduce chances of infection. Quite frankly, vaccines are keeping thousands out of Bay Area hospitals and morgues right now. Many more would be infected had so many residents not chosen to get vaccinated. If you are 12 and older, we urge you to get vaccinated as soon as possible. It will protect you, those around you, and help keep our region safer.